Well, why don't we go ahead and leap into some of the issues then? Um, if you could start with talking a little bit about your story, about how you got interested in climate change issues and how how journalists can pull these kinds of stories out of others. Yeah?
Yes, sure. Actually, let me start with a little bit how I interested with the environmental health first and how it goes to the climate change. Because I am trained, very clinical, trained medical doctor, and I was always in the, just specifically when I was working with the patients, because my residency is pulmonary medicine, and I work with the many asthma, chronic bronchitis patients, and constantly I start to, because we ask the question about their symptoms, and after, just according to symptoms, we, just write the medication, and that's it, just we are done that point. But when I do my residency, I'm very junior level, I start to figuring out that no, we are not helping these patients. We are just writing the medication, and I'm seeing the same patient 1 month later again with the same symptoms, same things happening. And actually, I had one patient, and I started talking with her, what's happening, why it's happening with your asthma, and she was teacher, just I said, why you are having this issue? You are a teacher. You are not in the very dusty place or anything. And I learned that they changed the whiteboard and they started using different pen, Sharpie for the school. And her asthma started that moment and it's getting worse and worse and worse. But until that moment, just I followed that patient like 1 year, maybe more. And when I start the questioning, I figure out what's happening. And in that moment, I really understand that, just as a physician, we are really missing the biggest point. We are not really helping our patients in that level. We are just really treating, but we are not really focusing prevention or what is happening in their life. And my interests go to the more environmental health, occupational health, and it comes. And so after that experience, actually, I went back to the school and just completed my MPH. Just I want to make sure that I understand the prevention piece, and especially for the environmental health. And I got the environmental health concentration in my MPH program. After that experience, I moved to Grenada in around 2008. And that time I started interested in more climate change and the health impact, because we were in the very like a heaven situation, small Caribbean island, and it's very nice place, just all beaches and everything is, there is no big industry or anything. But I start looking to their asthma prevalence and the chronic bronchitis prevalence, and they are high. And also they are not smokers, they do marijuana kind of things, but it's not really, tobacco smoking is not that prevalent there. So I started looking to, okay, what else is happening, just the one issue was of course mold, just connecting with the tropical, but also climate variability change and the flooding increase in the island, and they have mold issues. Another issue came up, the Saharan dust exposure, and it was not just it's happening in Grenada, but in around the many islands, and especially drought increase in the Africa and other piece, and that dust coming to uh, Caribbean, and I started focusing to that kind of piece, and we look at the different exposure among the people in the population. So that part is really, just make me more interested in climate change, because we always connecting with especially respiratory diseases, connecting with the very standard industrial issues, or that specific risk factors connecting with the exposure. But in that kind of island environment, really nothing around there is a just many sense. And that time I start interested in more climate change, and I have the couple studies specifically working there.
Um, but one of the things that this brings up for me, as an immigrant myself, and is there it's not just dust coming from the Sahara, right? It's people who are environmental immigrants, right? Can you talk some about that?
Actually, that environmental issues causing all kind of refugee crisis and other pieces. And in the Caribbean, what I see that specifically with the Caribbean, because with the land degradation, they start also with the climate variability, they start losing their land. It was a huge project, actually, one of my project specifically focused on land degradation and the impact island, because of the land degradation. And they also start to losing their beaches because sea level rise, land degradation, everything is impacting back to back. And they start to leaving the island, just they cause some refugee issues, just specifically they moved to mostly America and some Europe. But because they lost their, especially also they got a couple hurricanes when I moved there, and they lost again their everything. So and tourism is going down because of you are losing your beaches, your coral reef, everything's connecting. And I keep saying that we are not just focusing one piece, just when climate change, everything's connecting and is impacting in the end. Impact is the well-being of the human and health, of course. So for that purposes, I saw there was a big issue that time.
Yes, thank you. Um, so um, one of the main things we wanted to focus on in this discussion was um, the importance of solutions journalism and the importance of being fact based and evidence based in one's approach, and where you've seen that done well and it has been helpful, and where you've seen it done poorly and it's been harmful.
I guess, just yeah, and if I look at it for more developing countries perspective, not the developed countries, is there's different regulation, different rules, different beliefs, so it's a little bit different, and the communication is a little bit different in developing countries. And my experience, especially with the, again, I want to talk to Caribbean, because Caribbean is really showing for everybody is just like a, this is the heaven, paradise, just everything is perfect in that island, just go for the vacation. But people, they live there, they suffer there. And that communication sometimes is not reached like a developed countries. Just it was the one of the biggest struggle that time for me, finding the fundings, because they constantly saying that, oh, you are in the one very nice island, really. Just what kind of exposure we are talking about, or what's happening there. And also sometimes communication is not going very well, because Caribbean islands, they are like a separate, of course they are separate countries, but when you put them together, this is a big population. But if you just focus that, okay, one island, 150,000 people, one country. Okay, why I need to help you, or why we need to really do something. It was the always discussion that how we can give to these issues as a whole region, and how we can communicate to these main issues for the region.